At a broad and simplified level, almost all psychoactive drugs, whether legal or illegal, can be categorized into four basic pharmacological groups based on their primary effects on the central nervous system. Let's explore the four main categories: depressants, stimulants, hallucinogens, and opioids. Depressants slow down the central nervous system, reducing brain activity and producing calming or sedating effects. They work by enhancing the activity of neurotransmitters that inhibit brain function. Common depressants include both illegal and legal substances. Alcohol is perhaps the most widely used legal depressant. Benzodiazepines such as diazepam and pregabalin are prescription medications often used for anxiety. Short-term effects include relaxation, drowsiness, and reduced inhibitions. Long-term risks involve dependence, cognitive impairment, and respiratory depression, particularly when combined with other substances. Stimulants speed up the central nervous system, increasing alertness, energy, and heart rate. They work by boosting neurotransmitters like dopamine and norepinephrine. Examples include both illegal and legal substances. Illegal stimulants include cocaine, crack cocaine, amphetamines, and methamphetamine. MDMA has a mixed profile, acting as both a stimulant and empathogen. Legal stimulants that many people use daily include caffeine in coffee and tea and nicotine in tobacco products. Short-term effects include increased energy, alertness, and elevated mood. However, risks include cardiovascular strain, anxiety, paranoia, and with chronic use, dependence and potential psychosis. Hallucinogens alter perception, thought, and mood. This category includes both classical psychedelics and dissociative drugs, which work through different mechanisms. Classical psychedelics like LSD, psilocybin, and DMT primarily affect serotonin receptors, causing visual and sensory distortions. Dissociative drugs like ketamine and PCP work differently, blocking certain receptors to create feelings of detachment from reality. Psychedelic drugs such as psilocybin, LSD, and MDMA are increasingly recognized for their therapeutic potential in mental health. These substances can cause profound changes in perception, thought patterns, and sense of self. Risks include psychological distress, particularly bad trips, and in vulnerable individuals, triggering of mental health conditions. Opioids are powerful pain relievers that work by binding to opioid receptors in the brain and body, blocking pain signals and producing feelings of euphoria. Examples include illegal substances like heroin, as well as prescription medications such as morphine, codeine, and fentanyl. While effective for pain management, opioids carry significant risks. Short-term effects include pain relief and euphoria, but also respiratory depression. Long-term use leads to tolerance, physical dependence, and high risk of overdose. The danger is significantly heightened in the illicit market, where opioids are frequently contaminated or replaced with synthetic compounds such as nitazines, some analogues of which are estimated to be up to 500 times more potent than heroin. It's important to acknowledge that some drugs don't fit neatly into one category. MDMA, for example, has both stimulant and empathogenic properties. Cannabis has its own classification as a cannabinoid, but can produce depressant, stimulant, and mild hallucinogenic effects, depending on the strain and individual response. Understanding these categories helps us recognize the effects and risks of psychoactive substances, whether legal or illegal, and supports informed decision-making and harm reduction. However, it's important to note that there are 7 drug categories in total: cannabinoids, stimulants, depressants, opioids, dissociatives, psychedelics, and empathogens.